Let's see some important dermatological images. Let's see some important dermatological images and revise about them. First image is this one. Here you can see black eschar with surrounding edema and redness. Okay, this is caused by Bacillus anthracis and diagnosis is anthrax. These eschars are painless and treatment is ciprofloxacin. Second image is this. Here you can see some leonine faces. This is nothing but leprosy. Okay, diagnosis is by biopsy caused by Mycobacterium leprae. Okay, then third one. This is very important image. See, here there is a white patch on the lateral border of tongue. If it is seen, if the history given is HIV patient, then it is hairy leukoplakia. This is an opportunistic infection. Fourth one. Here you can see edema in the neck, looks like bull neck, and you can see there is pseudomembrane over the tongue. So this is nothing but diphtheria caused by Corynebacterium diphtheria, and treatment is benzyl penicillin plus antitoxin. You see this, there is redness, swelling, and it might be tender also. This is nothing but cellulitis. Okay, cellulitis caused by mostly gram positive organisms, Streptococcus pyogenes or Staphylococcus aureus. So what is the treatment? Flucloxacillin plus benzyl penicillin. Clindamycin can be added if it is not resolving because of the anaerobic, to cover anaerobic bacteria. Okay, next. You can see similar picture, redness, swelling, and along with this bullae. If bullae is present, that means the infection has penetrated into the deeper layers, that is fascia. So this is nothing but fasciitis, necrotizing fasciitis. Treatment is the same. Next, this rash is very important. This is nothing but erythema chronicum migrans. So this looks like bullseye appearance, targetoid rash caused by Borrelia burgdorferi. Okay, next image. Treatment is doxycycline. Next image. Here you can see inside the cells there are ring forms. In one cell there are two ring forms. That means this is falciparum, Plasmodium falciparum. Okay, next image. If you see, there is some destructive lesion. The nasal bridge has gone destructed. Okay, so this is mucocutaneous leishmaniasis. Okay. Then if you see here, there is some surrounding hypopigmentation. This is post Kala-Azar dermal leishmaniasis, PKDL. The treatment of leishmaniasis is sodium stibogluconate. If you look this image, you can find small red bumpy kind of lesions, looking like pimples. They are fluid filled blisters. On scratching them, they may turn into scabs. This is nothing but chickenpox rash. Treatment is IV acyclovir or oral acyclovir. Okay, here if you see, this is also similar kind of blistering rash which is following the dermatomal pattern. This is zoster rash. Here also the treatment is oral acyclovir or ganciclovir. This image is, you can see there is sinus formation and there is swelling. So this is nothing but cervicofacial actinomycosis. So there is some rash on the palms, rash on the soles. In the question they have given, they might give a clue of generalized lymphadenopathy. This is nothing. If this is associated with generalized lymphadenopathy, that is secondary syphilis. Here cervical sores over the lips. So this is HSV1 infection. So treatment is acyclovir. Here if you see this green color one, this is dendritic keratitis. caused by again HSV. Dendritic ulcer. This is caused by HSV. This is very important. You can treat with topical eye drops. If there is associated ophthalmicus, then you can go for systemic treatment. Next image. This is mycetoma foot. There are two types of mycetoma foot. One is eumycetoma, the other is actinomycetoma. Eumycetoma is caused by fungus and is less severe, and it takes long time to progress and late bone involvement, whereas actinomycosis is caused by bacteria. It is very aggressive. There will be more sinuses, more early bone involvement, and more severe form. So eumycetoma responds to antifungals, and actinomycetes foot respond to antimicrobials. Okay. Next one is very important. Molluscum. You can see pearly white umbilicated papules. This is molluscum contagiosum, seen in immunocompromised patients or in hostels who share each other's towels and all. Next image. Okay, if you see here, the lesion is tense, blistering. So it is bullous pemphigoid. D for deep. Only deep blisters can withstand and do not lose their shape. Whereas here blisters are not intact. So these are flaccid blisters. These are seen in pemphigus vulgaris. Okay. Both treatment is steroids and immunosuppressants. This is erythema multiforme rash. Erythema multiforme rash you can see in mycoplasma infection. Okay, this is Stevens-Johnson syndrome, mucosal involvement. Okay, this is Stevens-Johnson syndrome. This is toxic epidermal necrosis. More than 10% of body surface is involved. So this comes under the category of toxic epidermal necrolysis. This is keratoacanthoma. This looks like small cell carcinoma, but it's a benign tumor. You cannot distinguish it from small cell squamous cell carcinoma clinically. So you have to biopsy it and observe in a microscope to differentiate. Then look at this image. This is Sézary cell. Sézary cell is seen in mycoides fungoides. It is a cutaneous T cell lymphoma. Sézary syndrome is mycosis fungoides plus Sézary cell. This responds to radiotherapy. This is, if you see this is Pityriasis rosacea. You can see this is herald patch or mother patch. First herald patch starts, then surrounding oval scaly patches develop as in the form of a fir tree. You can remember tree and rose are linked. This is a self-limiting disease. This is often occurs after HSV7 infection. It resolves spontaneously. HHV7 infection. Okay, then this you can see is lichenous planus, plain, polygonal, purple rash. You can see white color, lace like structure over it. This is called Wickham's striae. White color lace is called Wickham's striae. Okay, Cobnus phenomena is also positive. Cobnus phenomena is nothing but if there is any trauma at the traumatic site, new lesion will start developing. So this is scalp psoriasis. This is also scalp psoriasis. This is also scalp psoriasis. This is psoriasis, normal psoriasis. So what's the treatment of psoriasis? You can give vitamin D supplements. You can give topical corticosteroids. If it is severe, then you can add on oral steroids also. Then if the nails are involved, then it is called psoriatic arthritis. And what is the treatment of it? You should start with methotrexate, then after you can go to secukinumab, ustekinumab, and this is simple lichenification. This is sclerosis, lichenous sclerosis. If you see this rash is this rash is seen on the extensor surfaces, itchy rash. This is this condition is called dermatitis herpetiformis. Dermatitis herpetiformis, seen as an association with one intestinal condition, that is celiac disease. What's the treatment? Gluten-free diet and Apsom. This is vitiligo. This is crusted scabies or Norwegian scabies. This occurs only in immunocompromised patients like HIV. There will be hundreds and thousands of scabies organisms in this. So this is normal scabies. This is normal scabies. Here permethrin topical lotion will be sufficient, but in Norwegian scabies you have to give permethrin lotion topical plus ivermectin as treatment. This is tinea. This is scarring. There is scarring along with loss of hair, so this is called scarring alopecia. This is alopecia areata. These are psoriatic nails. Psoriasis. This is, if there is any arthritis symptoms, you can associate it with psoriatic arthritis. There is pitting. There is onycholysis. Onycholysis is separation of nail bed from nail plate. This is wart. HPV wart. So if it is single, you have to remove it with cryo. This is arthritis mutilans. You can see this in psoriatic arthritis mainly. You can also see it in rheumatoid arthritis. This is ichthyosis. This is cutaneous vasculitis. Generally cutaneous vasculitis is medium vessel vasculitis, so you can call it as polyarteritis nodosa. Then this is important. This is erythema nodosum. These are subcutaneous, tender, small, round shaped subcutaneous infection. This is result of paniculitis. It can be due to various reasons. It can be physiological, like in pregnancy, OC pills. It can be seen in tuberculosis, sarcoidosis, many conditions. Just remember, these are tender subcutaneous nodules, especially seen over the shin. This is necrobiosis lipoidica. It is seen in the patients of diabetes. You have to treat it with topical steroids. Okay. Then this is granuloma annulare. This is also an infection. This is also a skin condition seen in the diabetic patients. There will be central depression and peripherally it will be hyperpigmented. This is fish granuloma. This is Mycobacterium marinum infection. This is impetigo, staphylococcus infection. You have to treat with topical fusidic acid or mupirocin. This is erysipelas, benzyl penicillin. Treatment is benzyl penicillin. Then this is important. This is dermatitis and this is pellagra typical rash. So